On this slide, we are looking at normal red blood cells, and I am on the 100x objective lens, which means that we have total magnification of 1000, and I'm using oil. So if we look at the red cells here, first of all, they're all pretty much round. That's a start. Second, they all, to some degree, have a central pallor, which is that center where there used to be the nucleus. Um, and there should just be, I'll move it here a little bit so we can have some comparison. The central pallor should always be a little bit lighter than the outer part of the red blood cell. And when that central pallor gets to be bigger, then we start to say that that they're hypochromic because they have less hemoglobin in them, or the concentration of the hemoglobin is less. But for the most part, these all look normal. And just to give you some point of reference as to abnormal, so in the center here, we have a polychromatophilic erythrocyte, which is basically a reticulocyte. So that's the first stage that we would see in the peripheral blood with no nucleus, because you remember that red blood cells lose their nuclei, or their single nucleus, before they leave the bone marrow. Okay, so let's see if I can find it here. There was another one that I wanted to show you, and let's see if it's going to be hard to find here. Okay, yeah, this one in the center. This one in the center that's a little bit smaller than the rest and basically has no central pallor. It's normal because, the bigger picture, we're looking at all normal red blood cells, really. But this would be an example, for example, if you had a lot of these, or if the majority of the red cells look like this is what a spherocyte would look like. And a spherocyte is a red blood cell that, looking at it, it's maybe a little bit smaller, and it has kind of a uniform color, and it really lacks a central pallor. Now, because I see one on this patient of the spherocyte, and I saw one polychromatophilic erythrocyte, I'm not going to get too worried about it. So for the most part, yeah, we're looking at a normal picture here. And you can almost always expect that there's going to be, you can see like these kind of stomatocyte looking things in the middle that look like kind of like a goat's eye. They have kind of that elongated central pallor. And, I'm seeing a few of those here, and I'm not going to get excited about those. But overall, these are normal red blood cells.